suggest you see that. So Stephen is going to give us a different angle on the economic implications of healthcare. Stephen, welcome.
Well, first I wanted to thank MiHIN for the opportunity and privilege to participate in this event today. Also wanted to thank Jeff and Tim. Every time I sit down with you guys, I feel like I'm getting continuing medical education on all the new and innovative things you guys are doing. Special thanks to General Granger. Every time you participate in something, you bring such great wisdom and insight, and you're such a blessing to our family, so thank you for participating in this. And finally, and most importantly, I'd like to thank my wife, Samantha, who's home with our 2 children. Baby Adele is 2 years old, and baby Grayson is 2 months old. And every time over the last few days I was practicing my talk, they actually fell asleep. One of the very rare, just a few of the very rare occasions they've actually slept the last 2 months. So my wife has a humble request that we get a copy of this talk today. So. I am here today, as Jeff mentioned, to take a little bit of a different angle. J&B is, with our different business lines, we are one of the largest providers of medical products to the homes in the United States. So my comments today are really framed around the optics of a provider. Worldwide, technology and its promise have moved up the healthcare agenda. Steve Jobs says that innovation distinguishes between a leader and a follower. Disruption is occurring in many industries today. In 2015, Uber is one of the largest transportation companies, and they own no vehicles. Facebook is one of the largest popular media companies, and they create no content. Alibaba is one of the largest retailers, and they own no inventory. And Airbnb is one of the largest accommodation providers, and they own no real estate. Great providers and state-of-the-art facilities are not going to be enough anymore in healthcare. Access to information is going to be the enabling and disabling factor today. The big idea is there's no one big idea. In effect, there's no one magic bullet that's going to heroically resolve all of our challenges. And this has a lot of implications because we have a fractured healthcare system where a great deal of focus and energy has been spent on trying to disrupt the system, and just in the same way some of the aforementioned companies did in their industries. Healthcare is not immune to disruptive forces. The old model of healthcare was a very high-touch model. Someone would go to their doctor's office. Someone would go to the hospital. A healthcare professional would come to the home. Many people over the last several years have forecast the new paradigm would be a high-tech model. There are telemedicine, there's telehealth, there's video conferencing, there's mobile apps, there's sensors, there's encrypted emails, there's encrypted text. We are all going to live in a connected health environment, but there still needs to be someone coordinating care. With all this data and information that's being generated, someone needs to coordinate care. So the real model will be a hybrid model. It will be a combination of a high-touch and high-tech model. Health will be provided by technology-enabled services. And there's no one solution, there's no one gifted gadget or application that's going to bring about the transformational breakthrough. But it will be the data and information provided by a multitude of these solutions, along with technology-enabled care coordination, that's going to bring the next generation of healthcare. It's not the volume of the data that's going to matter, but it's the value of data and the ability to act. Even with all the complexities and fragmentation in our healthcare system today, the wave of disruption is coming. Henry J. Kaiser, the founder of Kaiser Permanente, said, "You can't sit on the lid of progress. If you do, you'll be blown to pieces." Every day, we create 2.5 quintiles bytes of data. 90% of the data today did not exist 2 years ago. I think Stephen Gould of IBM Watson had a great metaphor for data. He said that it's like fuel. In the ground, it has a certain value. When you take it out and you start to refine it, you amplify its value and its usefulness. Big data usually refers to a combination of structured and unstructured data, and a lot of folks today talk, various forms of that. and it's measured in petabytes and exabytes, and it's often said to be characterized by the 3 V's: the volume of data, the variety of data, and the velocity with which it's processed. But these are all make it very challenging to manage. Small data, which you don't hear a lot of people talk about, is the data in a volume and format that makes it accessible, informative, and actionable. Data is too numeric today. We have too much of it. So data visualization tools will be critical for us to understand what all this data means. Moreover, 85% of our population learns best by pictures. I can tell you I do, and I can tell my daughter does today as well. Moreover, the timing of the data is going to be very important, and the actual data needs to be received in a workflow that can affect your decision-making process. Hence, these are the discussions we've been having as a provider with MiHIN. Our company, our parent company, J&B, and HealthNet Connect, which is our virtual care company. How do we receive these ADTs, admission, discharge, and transfer alerts, to better coordinate care? I can tell you, as a provider today, when someone goes to the nursing home, we may not find out for a month or two, but we're still shipping them products, not because we want to, because we don't know. Unless they reach out to us, we don't know. And so, working with MiHIN, we believe that just receiving the admission, discharge, and transfer information could play a very critical role in taking care coordination, not just for us, but for all the providers out there, and help us save the system a lot of money. As Jeff said earlier, someone's paying for this inefficiency. Maybe it's us, maybe it's the state, maybe it's the payers, but someone's paying. And we need to cut that inefficiency out of the system. The data market today is large and it's growing. Depending on whose numbers you believe, big data market today is about 32 billion and will be about 53 billion in 2017. Many project big data could save the U.S. healthcare system about $300 billion annually. 25 to 50 billion in better care coordination, 125 to 175 billion in mitigating the waste, the fraud, the abuse, 175 to 200 billion in better administrative and clinical efficiencies. The biggest benefit of big data is how it helps us act as a platform, in effect, to predict the future for patients, opening the door for more prevention. The traditional healthcare model has been detect and respond. The new model will be anticipate and prevent. I was just in La Jolla, California, and there was a longtime La Jolla resident, Theodore Giesel, that lived out there for many years. Many of you might know him as Dr. Seuss, and he had a Dr. Seuss-like quote that I think applied to big data. He said, "Oh, the things you can find if you don't stay behind." Once you have the data, it can be translated to information. This information can be leveraged in a variety of ways. General Granger talked earlier about precision medicine. Simply, we need to deliver the right care at the right time to the right patient at the right value. There are many challenges to go to where we need to go. Some of these challenges include interoperability, privacy, and reimbursement. Well, you folks know a lot about interoperability, but just some interesting statistics. According to the Department of Health and Human Services, 20% of preventable medical errors are caused by lack of immediate access to data and information from the medical records. 1 out of 7 primary care visits is impacted by missing medical information. We spend about $30 billion a year because of the interoperability challenges that we have. So I'm proud to say that MiHIN has really been a leader nationally in helping streamline these efforts. And believe me, when you go to other places, I appreciate MiHIN more and more every day, put it that way. Just with interoperability, an analogy that I thought was very apropos, Steve Jobs, many people think Steve Jobs is a great innovator, he was a genius. And you look at what he did with the iPod, and the MP3 technology was out there. Many people had the MP3 technology, but he made a cool looking device. You press an icon, you are listening to music. He made the process simple and seamless. That's what we need to do in healthcare. Another critical barrier to success will be managing privacy issues. There are many pitfalls with patient health information that many of you have eloquently brought out. The answer to me here is simple. We need an opt-in approach. Patients are going to have to willingly choose to share their information. In a recent Intel Innovation Barometer study, published in December of 2013, 84% of the 12,000 respondents said that they would anonymously share their personal health information to advance and lower the cost of our healthcare system. We're going to all have to be more responsible and participatory in our healthcare. And then finally, the incentives are going to have to align with some of these innovative approaches. CMS has recently announced in March of this year that for the new ACOs, the next generation of ACOs, they are going to start, you're going to be more at risk, so there's going to be more savings, and they are also going to start paying for telemedicine in urban settings and also remote patient monitoring. And we really believe that this will play a very big role in helping move the wave of innovation and disruption forward. Big data initiatives have the potential to transform healthcare. Stakeholders that are committed to innovation, willing to build their capabilities, and open to a new view of value will likely be the first to reap the rewards of big data and help patients achieve better outcomes. Jonas Salk said, "Hope lies in dreams, in imagination, and the courage of those who dare to make dreams a reality." Walt Disney said, "All of our dreams can come true if we have the courage to pursue them." My friends, if you dream about the next generation of healthcare in our country, better measuring, managing, and optimizing data and information will be the key to making this bold vision a reality. Thank you.